Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I'm live in studio on this absolutely gorgeous, beautiful Mother's Day in the Washington capital area. I hope all of you ladies have a wonderful day. We're here to answer your questions on any subject that you want to cover relative to a non-drug, non-surgical approach, from chiropractic, from acupuncture, from nutrition, from all of those things that have no harm but only profound benefits to what goes on in your body. We're here at 105.9 FM and AM 630 WMAL. Give me a call, 888-630-9625. That's 888-630-WMAL. Love to talk to you. We have a topic that we're going to discuss with you today. It's one that affects so many people, particularly living in this area. They don't call it foggy bottom for nothing. That means that we have mold and fungus and pollens and all those things in our environment, probably more so than any place else in the nation. In practice, over many years, I've had patients come in and say, I never had a problem until I came here. Well, many of you this year went through one of the worst allergy seasons I have ever experienced in my 35-plus years of practice. Coming in sick, not feeling good, rapidly converting from an environmental problem to a bacterial infection, infecting the lungs and the respiratory system and so forth. Well, guess what? That topic is going to be our in-house continuing education program this Wednesday evening, May 16th at 7:30 p.m. We're going to be talking about allergies and immune function, and your presenters, your hosts will be Dr. Stephanie Pina and Dr. Leonard Poe, who are my guests today on WMAL. Hi, guys. Good morning. Or afternoon.
Morning.
Well, guess what? We're going to discuss that topic and hopefully answer a lot of questions because it's one that has such a profound effect on so many different people in many different ways. People think that when they're exposed to allergens, particularly environmental allergens, the only effect that they have is that they sneeze and they cough and, they have the runny nose and the burning eyes and all of those things. But yet it's much more profound than that. There are many other things that show up. Talk to us a little bit about it, and I'd like to go back and forth with you relative to what are the symptom processes other than what we would normally expect them to be. How do they present themselves?
Well, different allergies are obviously going to affect the body in different ways, and a lot of people are used to the runny eyes, the congestion, and, that's what kind of brings people into the office quite a bit. There's a lot of office visits during this time of year and also throughout the rest of the year based off of what's going on with the weather. But allergies can go on beyond that and affect essentially the gut, your digestive tract, your immune system, and all of those are going to hamper your healing response.
Yes, essentially when you think about allergies, what we're talking about is an immune response. So relative to how bad your allergies are, how many more allergies you're starting to pick up. We hear all the time that my allergies are getting worse this year. I never used to be allergic to that, but now it's starting to bother me. That's a change in your immune system. You got to realize that the pollens and the molds and all those things, while they're out there and they do affect us, these are the same trees we've had in this area for, hundreds of years. It's not the trees that are changing on a yearly basis. It's your immune systems that's changing, and that's the big piece that needs to be looked at and treated and changed.
So it's the patient that's actually breaking down and becoming much more susceptible to the environment and symptom processes expressing itself.
Exactly. This is the same thing when we talk about, why do people get colds and flus and get sick? Is it the bacteria or the virus? Well, no, because everybody in the same room is exposed to that. If that was the case, then everybody would be sick, but that's not what happens. It's the immune system and how it's changing you and all those pieces that affect immune function. So stress is one of those big ones out there.
Well, stress is a presentation from three different areas. As we know, we look at it from not only emotional stress. Living in Washington, D.C., most of us have multiple levels of emotional stress, from our credit cards being over the top to our mortgages being too high to having to get to work and not enough time to get it done. We catch as catch can. But also injuries that we put up with, pain patterns affecting the nervous system, things not working the way they're supposed to, and then the biochemical, the garbage we eat, the sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives, the junk that we put into our bodies. Those are the things that break our bodies down.
Poor gut mediation is probably the biggest segue into all these allergy patterns that we see.
Dr. Pina, when you see a patient, and Dr. Pina is a naturopathic doctor and also a acupuncturist, when you look at a patient that has multiple environmental allergies, what shows up? What do you suspect when you examine that patient?
Well, one, when you always have environmental allergies, you want to see what kind of exposures, where they're living, what they've done for an occupation. A lot of that can have an idea because those are going to be areas that they're going to be surrounded in for a long period of time. When patients come in, you want to see what's worked for them, what hasn't worked for them, and also kind of where's their immune system at this point. How are they dealing with the even regular cold and flu? Because if they're having trouble with basic things that we should get over quickly, then their body's not going to be able to even get out the toxins and the histamine responses that they're getting from other allergens.
This Wednesday evening, May the 16th at 7:30 p.m., Dr. Leonard Poe, Dr. Stephanie Pina will be your co-presenters at the Roselle Center for Healing in Fairfax. We're just off the National Capital Beltway, about a third of a mile. In the Red Cross building, we'd like to encourage you and invite you to join them. I think they're going to answer a lot of questions for you, things that you can do, you can take home and do immediately, and gets very specific with them. They're going to both be there to answer your questions afterwards. We'd love to have you attend. Give us a call, 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend. As always, these are our gift to you. All we require is a reservation because we have limited spacing, and once they're filled, but we'd like to have you there. Please give us a call. Let's go to the phones just for a quick minute, and then we're going to get back to our topic. Helen, thank you for calling. How can I help you?
On occasion, not occasion, every day when I take my blood pressure, I do my left arm first and then my right arm, and my left arm is always 10 to 15 numbers higher. Is there any concern about that?
Well, the truth of it is, Helen, is that there is a differentiation between one side and the other, and the left side should be the highest. But there shouldn't be more... I'm sorry?
It shouldn't be that far apart, should it?
No, it should be 5 millimeters of mercury differential. 6 is fine, 7 is okay. But when you get to 10 or more, you start considering cardiovascular problems, either hardening or clotting of the arteries as they go into the heart, so the heart has to push harder to get that blood back into the system. So that may be a problem. It can be a problem with the energetic pattern on one side of the body. Dr. Pina, we know that the acupuncture system is redundant, meaning that we have energy pathways on one side and energy pathways on the other. One side could be excess causing this problem, and one side could be minimized causing this problem. Can you give us a little bit more insight on that?
Yeah, essentially, every time we think of cardiovascular disease, and even when we're measuring blood pressure and kind of how the blood's getting down to the extremities, the one thing that we want to look at is, are there things that are actually blocking blood pressure, or are the blood flow, or are there things that are actually allowing it to flow properly? So even when you look at excess and deficiencies on one side, where there may be more tension on one side, either in the muscle structure, or the blood can't flow properly coming out of the spinal area, there can be a lot of differences on one side versus the other. And when someone starts to have more and more stress and response, that's going to become more prevalent.
So Helen, here's the skinny on the situation. It's not normal. It's something that needs to be explored. Medication is not going to remedy the problem because it's just going to be blocking the underlying why is that. So what I would encourage is a full examination from our point of view, finding out where the system is not working properly and why this is beginning to present. So you need to take that next step. If we can help you, please give us a phone call. We'd be more than happy to check it out. We're here at 888-630-9625, 888-630-WMAL. Love to talk to you. We're talking about environmental allergens and things that you can do about it. Your co-hosts and presenters this Wednesday evening, the 16th of May, at the Roselle Center for Healing is Dr. Leonard Poe and Dr. Stephanie Pina, and they will give you the skinny on this whole thing and actually give you some really straight-up information. My biggest problem in the springtime is that I want to go to sleep. I mean, I am wiped out. I get out of the house. By the time I get to the office and I'm 2-3 hours into my day, I feel like somebody drugged me. How does that happen?
Back and forth here. Obviously we want to tie this into the allergy pattern portion of it. That feeling that you get with allergies, like I said, we're talking about immune responses, and really what we're talking about are inflammatory responses. When your levels of inflammation go up for whatever reason, whether we're talking about allergies, where we're talking about traumas, when your inflammatory rates go up, then the anti-inflammatory system, which is the adrenal system, has to go up to match it. And so if one gets raised, the other's going to get raised, and that adrenal system is then going to start to get worn. And that's when we start to get tired and we get sleep, because the body's essentially trying to heal you. It's trying to fix this. and it's going to want to put you to sleep to do it.
Well, we have, in the springtime, we have high levels, obviously, of fungus and spores and mold.
This year is
and
terrible.
So
I mean, with the winter we had, nothing really got... The tree molds are terrible still, because nothing really got killed off.
Yeah, the ground wasn't frozen, so you have everything coming up from the dirt as well. And that hits you. And I'm very, very mold sensitive. I have been my entire life. And when I get into that overwhelm, if you will, if I'm exposed to anything that is moldy or fungusy for any length of period of time, that's the response I get symptomatically, and a lot of people have that as well. So is this something people have to live with? Is it something that can be mediated in a way, particularly when they suffer it year-round? And there's many patients, as you know, that we see that with.
Yeah, of course. Especially when we're talking about stuff like mold and fungus, there's probably a candida buildup. And we find it all the time in testing. When we look through, we do stool testing, we see, well, what's in the gut, what's in the system. We know year over year over year, you're going to start to build that up. So a lot of times it's a matter of cleaning from the inside out. But if you mediate and you give the body what it needs, and we're not talking about pharmaceutical intervention here, but if you give the body what it needs to operate its physiology normally, then it will handle the inflammatory response, it will handle the allergen normally, and you won't have this huge histamine response and the runny nose and the fatigue and, you know, the irritation and the itching and all those presentations that go along with it. The immune system will act normally to it, and it'll take care of it.
Dr. Pina, when a patient comes in with that type of presentation, they've said their doctor, their medical physician, their allopath said, take this antifungal, this anti-mold medication, and it'll wipe it out, it'll take care of it. Two questions. One, that's dangerous. What are the side effects? And secondly, does that work, or is it just something that's waiting in abeyance to come back again?
Well, it's interesting when they start kind of addressing allergy symptoms with kind of looking at other ways, like looking through the gut and saying that there's that candida buildup and using antifungal. The antifungal tends to be a pretty toxic substance. In fact, a lot of the antifungals have been kind of either pulled off the market or basically have been used very limited because it does affect a lot of areas of the body. The main thing is, as well, it's going in to find that fungus. It's also going in and killing off some of the good bacteria that's trying to protect us at the same time. And sometimes it can be a matter of not just treating it with medication, but essentially doing things at home, like when you're talking about the sleep, trying to get the best sleep possible and actually changing up the environment. Like if you're getting sensitivities to outside allergens, making sure that you're not wearing the same clothes that you're coming in from outside, that you're changing pillowcases, that you're kind of limiting your exposure, especially in that bedroom area where you need to get that deep sleep in order to heal.
So in other words, if we wake up in the springtime and we feel drugged, it's because of the mold and the fungus and the spores that are out there. Bottom line is that when you try to attack the body with a medication, the side effects are incredible in some cases. They're going to go after the liver. You know that if you've ever been put on these drugs, your doctor has told you that you have to have a blood test every couple of weeks to make sure that your liver's not crashing on you. They're dangerous. The point of it is this stuff is reversible. You can change it, and to know how, this Wednesday evening, May the 16th, 7:30 p.m., please be our guest at the Roselle Center for Healing. Give us a call, 703-698-7117. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you. My guest in studio, Dr. Leonard Poe, Dr. Stephanie Pina, your host this Wednesday evening, May 16th, 7:30 p.m. at the Roselle Center for Healing. Guess what they're going to be talking about? Environmental allergens, those things that make you crazy this spring, and some of you are still suffering with them. What we want to get you to know is this, that these things are preventable and that you can desensitize before you get to that place. Many of you saw the MTV True Life presentation that I was a part of this last year with a girl that came in that was extremely, extremely sensitive to virtually everything. And what we want you to know, whether it's a food allergen or whether it's an environmental allergen, these things are really fixable. And it's fixable by changing not just the exposure, but also changing the way the body handles the exposure. Mark the date. October the 20th, Ageless Health 2012, How to Live in a Stressful World and Do It Well and Healthfully. It's an all-day presentation. It's our keynote event. It's one that we do every year and have done for probably the last 13 years. This is an amazing day for all of you. It'll give you more information and show you how to apply it to reclaim your health, for you to understand that your health is a do-it-yourself program. We have a very special guest that will be presenting with us, Dr. Evan Mladenoff out of Kansas City. Evan will be talking about the emotional side of healing. Evan was with the Kansas City Chiefs for 12 years as their chiropractor, their applied kinesiologist. Brilliant, brilliant doctor. Go online at rosellecare.com and take advantage of the early bird specials and save yourself some money. It's not expensive even at full price, but you have an opportunity to save about 15%. But you have to do it soon because we're going to take that special off very shortly, so don't waste time. rosellecare.com. Question, Dr. Pina, Dr. Poe. When we have environmental allergens, we can't avoid the exposure. And one of the ways that we deal with patients who have food allergies and so forth, after we desensitize, we avoid the exposure until the body can step up. Here's a situation where we can't totally eliminate it. What do we do?
Well, essentially, the first thing you do eliminate either from the diet or try to get moving from the situation. And what the idea is that eventually you'll be able to kind of put it back into the system and then see how they kind of respond to it. But the immune system, the gut, everything that we've talked about before that's involved with the healing process really has to have that time in order to repair itself. If the person still continues to have that response, we just know that they're not ready yet. Their body's not ready for the allergen to be introduced. So really it's going to take some more time to basically help their body heal.
If with the environmental thing, you're going to have to go outside, you're going to have to breathe, obviously. So, you're going to be re-exposed to those. That's where a lot of real simple nutritional therapy comes into play, neurological therapy comes into play. If the neurology is working right, if the immune system is working right, and if you give it that little bit of nutrition to help kind of get over the hump, a lot of times that's enough. You just got to build up this system a little bit.
Well, when we're dealing with environmental allergens of any kind, we know that we have...
And you have to differentiate them, too.
Yes.
Because there's a different... you're going to treat a pollen allergy different than you're going to treat a mold allergy. So it matters. And that's where you have to get very specific with, well, which one is it that's really the one that's knocking you down?
And which system is affecting? It could be the lungs. It could be the respiratory system. It can be just white blood cell suppression, so you don't have the defense mechanism to go after it.
It's the why.
It is the why. It's the why is that. But if you suppress immune function, which so many drugs do, now you have another problem.
Yeah, we started talking about that earlier. A lot of taking these pharmaceuticals for this. This is a lot like saying, okay, well, we've got a mafia problem in New York, so instead of going out and arresting the mob boss, let's just hit New York with a nuclear weapon. It's overkill. You're destroying the whole train. There's nothing usable left. You just get very specific about supporting the immune system or supporting the system that's keeping the immune system from being upregulated the way it's supposed to, and you'll get rid of the allergies just fine. You'll get rid of them quicker, and they won't come back.
Dr. Pina, when you're looking at it from a environmental vantage point in the application of herbal remedies and so forth, do you have to be careful with the herbal remedies as well?
Yeah, of course you have to be careful with them because there are herbs in there that while you're trying to decrease the histamine response, they're still going to work very similar to some of the antihistamines. So if you're already on a medication and then you decide to add in something herbally, they're going to kind of go against each other or they're going to work with each other, and that can lead to some issues there. So you want to make sure the same thing goes when you're trying to identify the actual allergen and what you're having issues with. You want to make sure you're choosing the right herbs, the right nutrients for that particular situation.
And in my experience over the years, when I use herbal preparations and remedies with patients, I try to stay away from the dry herbs because of that, because of the mold and the fungus that can build up in it. And tinctures usually serve the purpose and do a much better job. But you still have to identify the target. You have to identify the system that's not working. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio, 888-630-9625. That's 888-630-WMAL. Happy Mother's Day, ladies. I hope you enjoy the day and that you're taken care of. And all of you need to pick up that phone and call every mother that you know and say, you know what, thanks for doing a great job. We have a wonderful nation and a great bunch of people out there because of all of you. 888-630-9625. My guests in studio, Dr. Stephanie Pina, Dr. Leonard Poe, who will be your guests, or your hosts, your presenters, this Wednesday evening, May 16th, 7:30 p.m. at the Roselle Center for Healing. Guess what they're talking about? Environmental allergens. We've gone through a really rough spring, and many of you have become profoundly sick this year, more so than any other time. Well, there was a reason for it. It started early, it went long, and everything in the world started popping up. Well, you can figure out what to do about it so you never suffer with these fungus and molds and spores and nastiness again. There's a way of really getting that done. We'd like to have you as our guest all you have to do is call my office at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend this Wednesday evening, May 16th, 7:30 p.m., presentation on allergens. Dr. Pina and Dr. Poe. Is that the P&P group or what?
I guess so.
I just realized that, P squared. And we won't go there, never mind.
No.
All right. So, listen, guys. Yeah, well, it's Mother's Day, right?
All right, let's move on.
And yeah, I know. And I slept in late today, which was kind of rare. That's why my brain's doing what it's doing. Allergen exposures of any kind have common symptom presentations. And we're talking about the sniffles, and we're talking about the headache, we're talking about the body pain, we're talking about even fever, we're talking about inability to breathe, wheezing at nighttime, all of that stuff. So if we looked at it as a group, all allergens together, what's the underlying system, if there is one that is primary in all of these? Is there one?
Overall, I'd say it's got to be the immune system, because anytime you're having an allergen, just like if it's a cut or anything, the body's there to protect itself. So really, it's going to kick up and basically try to produce some of the saliva, the tears, the mucus that we usually get in excess with certain allergies, but that's really a protective mechanism to begin with. And when it starts to go overboard and gets out of control, that's when we start to kind of feel more of the symptoms, and everything kind of brings us down and makes us drowsy, and then we usually try to look for some kind of help at that point.
So if a patient has, this exposure in the springtime, and they have all these pollens and spores and mold and fungus coming after them, and it accumulates in their body, the triggering mechanism, the immune response, is due to several different things. Obviously, the adrenal system, the fight-flight system, the intestinal system, because that's your first line of defense, starting with your mouth and going all the way through. You have to produce antibody reactions. You have to produce certain enzymes to break these things up so your body doesn't become overwhelmed with them. The thymus, the spleen. So when you see a patient like that, are they all involved? Or do you take a priority check on these different organ systems, and where do you begin the weeding process to find out where to treat?
Most of the time, it's not just one system. Usually there's multiple systems involved. But the history will tell you that. What are the other problems you're having? And, when we talk specific about the immune system, the thing to remember is that when we always kind of dummy it down and just it's your immune system and it's what keeps you from getting sick. There's lots of different parts of the immune system. They all do different things. So you can have allergy responses and not get colds and flus. And it doesn't mean that the immune system's well. It means that maybe one part of the immune system's working well, but some of the other parts aren't. So it's important to differentiate that. But yeah, then you got to look at, the intestinal tract. How are you digesting food? I mean, is it more gut mediated? Is it in the respiratory tract? How are you breathing? All those. I mean, you've got to start separating those out. But the history will tell you that. When you start to see all the other pieces that are going on, and that's why we look at whole body. When you start to see all these other things, you can start to draw all these together and figure out, okay, these are the primary mechanisms. These are some of these secondary mechanisms, and you go about fixing them.
One of the things I've noticed this spring is that a lot of people come in with eczema or rashes, and my brain tells me that we have some exposure going on that wasn't there before. So, Dr. Pina, when you see a patient that comes in and, they present to you, you're treating them, and you see these blotchy red circular areas, is it in fact eczema, or is it a manifestation of mold and fungus? How do you distinguish it, and then what do you do for them?
Well, you always want to get a good history on what that person may have been exposed to, how they've reacted to different, in different seasons in the past. And essentially you want to see also if they have any history of any other skin issues, because this could be an inflammation flare-up from something, or their body's basically dealing with the inflammation that they're having at that time. When I tend to think about it as far as when you start seeing things present in the skin, in Chinese medicine, that's so covered under the lungs themselves. So the lungs are not only helping you kind of with breathing and respiration, but it covers the skin. So when it can't get the toxins out, or it's having trouble dealing with the allergens themselves, it's got to find another way, and it's going to typically go through the skin. So you see those connections between asthma, allergies, and eczema, and different skin conditions come up quite often.
And in testing patients this spring, I've found that one of the two most effective things that people are checking for is nettle and also golden seal. They have a profound effect, but they're very specific. They're for mold and spores. Dr. Pina, when you're treating a patient from a place of a naturopathic mode, or what are you going to do with this patient? How do you take them through the process? Is it simply enough to say, here, take this, or do you have to begin to unfold other areas before the herbal preparation will be effective?
Well, when you're starting to add in herbs, basically what you want to do is see what they've used before and if they've had any response to it. Because like you were saying, different herbs are going to work differently. And you don't want to overload the system and kind of drive it into overdrive at the same time. When you're sitting down with them, you want to make sure that they're also able to get all the same nutrients and water and hydration in there. So if the herbs start to work and they really need to start detoxifying their body in order to get this allergen process out and these toxins out, you have to make sure that you're using the right herbs that are going to be working with what they're doing with their lifestyle.
We're here at 888-630-9625, 888-630-WMAL. This Wednesday evening, the 16th of May, 7:30 p.m., Dr. Stephanie Pina, Dr. Leonard Poe will be your hosts, your presenters, at the Roselle Center for Healing. They're going to talk about environmental allergens and how to get rid of them, how to really turn the clock around on these things to get back where you're not susceptible and you're not going down for the count, so to speak, that you don't feel like you're dragged out and pulled through a knothole, that you don't have the sneezing, the coughing, and the possibility of this stuff converting into something that is even more devastating or a combination of different problems. All you need to do is call us at 703-698-7117. That's 703-698-7117. And let my staff know that you'd like to attend this Wednesday's presentation. I think it's going to be outstanding. I'd love to be with you, but I'm not going to be here. I'm going to be, as you're presenting, I'm going to be somewhere over the Pacific, flying to China. And I will bring back magic secrets from the Orient for you, for all of us to apply.
You'll be missed.
Yes, I can tell. Celebration time and party time is going to happen at the Roselle Center for Healing. I can feel it. I'll feel it all the way there. Dr. Poe, we both use a lot.
Gotta keep your suitcase away from me.
Yeah, I know. I don't want to be stopped by the authorities going into
locked
China.
Up abroad.
Yes, I may be there for long. I've been told that I better bring the U.S. Embassy phone number with me and make sure that I behave myself while I'm going over there. But I think Dr. Mladenoff will keep me in check and he'll keep me out of trouble.
I'll do it for Evan's sake.
You'll do it for Evan's sake. Quercetone and QC spray and things of that nature work profoundly well.
Has worked very well this season.
They make a big difference. Why?
Because it helps with the inflammatory response.
So it causes the tissue to shrink back down.
Right, and that's primarily when we talk about especially with sinuses and things like that, where the tissue is just so swollen. You got to remember with sinuses, it's a cavity. You've got a finite amount of space in there, and when it gets inflamed and it gets swollen, that's when we get pressure and we get pain. And the quercetin in this season has worked profoundly well in patients to get that swelling down because the adrenal system for most of us isn't able to get it done.
Can't handle it. Most of us are so stressed out that we have no idea, where things are coming from. But if we look at the basics of the stress patterns, the structural stress, the emotional stress, the biochemical nonsense.
Real stress, imagined stress.
It's all the same.
Everything.
It affects the body the same way. The body doesn't know the difference, actually, because it reacts simultaneously. All those systems, the adrenal system and the intestinal system. You have an interest in the gut relative to initial mediated responses when it comes to any kind of immune system problem. This is no different.
Right.
And so...
Well, you got to remember, it's one big track, right? I mean, from oral nasal cavity, sinuses, respiratory tract, gastrointestinal tract, it's one big track. It's one big mucal membrane. And so when one area is irritated, typically the other area is irritated as well. So
we could have an underlying problem with the gastrointestinal system first, meaning anywhere from the lips down to the anus, and that's going to trigger the mechanism in an environmental problem.
Exactly. So
what do you do with these patients? Do you have to treat just the allergen problem, or do you have to treat the other sensitivities also to get the body to be able to heal?
That's the trick. You've got to treat it all. You can't just fix the component in the respiratory tract and get the sniffles down in the nose without going through and figuring out, well, is the gut irritated as well? Are you eating things that are causing that constant systemic immune reaction? You've got to figure those patterns out and fix those as well. You've got to calm that system down.
So many people after... even younger people today, I was going to say after age 25 to 30, have hydrochloric acid deficiencies, but we see them in children as well now.
You've seen them a lot, yeah.
but we have this burning, and you tell a patient, listen, I need to supplement you with hydrochloric acid. And they look at you like, well, my stomach's already a mess. Why would you do that?
Why would I do that?
Why would you do that?
Well, to get them better, obviously.
I know, but what does the hydrochloric acid do? And my question even more so is, why are they hypochlorhydric? Why is the digestive enzyme levels very low?
Then we come back to talking about stress again. When your adrenal system gets activated and your stress levels go up and you go in that fight or flight pattern, one of the real basic physiological reactions that we have is that stomach acid production turns off because it's just not important. All the blood flow leaves the core of the body, goes out the extremities because you're trying to run away from something. You're trying to fight something off. And digestion is just not important. It's not important to digest that meal you just had if you're going to be eaten in 30 seconds. So all the stomach acid goes down, all your digestive enzymes go down, you're not making them. And you got to remember that stomach acid is the primary gatekeeper of infection getting into the gut.
Yeah, that presupposes that, meaning if you're strong enough to handle the environment, it presupposes that your IgA antibody response, your mucus secretory IgAs are working the way they're supposed to, but unfortunately they're not.
They're not.
Dr. Pina, when you're looking at it from an acupuncture point of view and you're looking at digestive stress, what are some of the reasons that occurs? Is there a different look? Is there a different way of handling that?
Well, it's interesting, even when you talk about from a little kid's perspective, since they're getting now, food introduction is so much earlier than it used to be. They're not getting the immune build up, and their digestive tract doesn't have a chance to really build earlier on before they start having exposures to possible foods with allergens in there. When you look at it from a digestive standpoint in Chinese medicine, the spleen, which we think of as more as an immune organ, is actually in charge of the entire digestive tract. So there's a lot of digestive enzymes and a lot of things that are produced in there that have to do with our immune response. Also, when you look at allergies in Chinese medicine, they're considered dampness. So that's what tends to have some of that mucus production, that heaviness feeling that when we have allergy responses going on, that kind of slows us down. When you treat it with Chinese medicine, and whether it be acupuncture, herbs, and even nutrition, you want to eliminate things that cause more dampness in the body, which tends to be things like milk, different kinds of soy products, even that cause more phlegm to be produced. And so when you look at it from an acupuncture standpoint, you're going to use points that are going to also treat the intestines and also the lungs, but you're also going to use points that help benefit the lungs to the kidneys, which goes back to the whole adrenal response.
You know, the total expression of health, the ability of the body to fight anything, comes from a place of what we look at as the triad of health, and the structural, chemical, emotional pathways ultimately being put down or expressed strongly to be able to return anything back to normal. And that's what our practice is all about. You have to look at the structural, chemical, emotional pathways to solve anything. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We've been in studio at 888-630-WMAL, as we are every Sunday at 12 noon, bringing you the most cutting-edge and up-to-date information on alternative therapies, integrative care from a chiropractic, nutrition, and acupuncture and emotional standpoint of view. This is the place where you get it fixed. This is how we give you options. And if you'd like to talk to us outside the radio, all you need to do is go to rosellecare.com. That's ROSELLECARE.com. And we'll be more than happy to get back to you. Also, if you'd like to talk to one of my doctors, just give us a call, 703-698-7117. And that's the number, by the way, that you call to register for this Wednesday evening's presentation, May 16th, on environmental allergens. If you'd like to figure out how to restore function once and for all, join Dr. Pina and Dr. Poe this Wednesday evening, and I promise you, you're going to find a way to fix this stuff. You know, there's a lot of crossover foods and allergens, and when it comes to environmental stuff, it's no different. And what I found over the years is there's things subsequently like wheat products and milk and dairy and cheeses and so forth, and even things like peanut butter and the glutens, which, Dr. Poe, I know you're going to talk about actually next week on the air. Mm-hmm. But the whole pattern is one that is totally fixable. So, Dr. Pina and Dr. Poe, if you had to leave this topic with a very specific why do these things happen, which is really the underlining pin on any type of allergen, what would you throw on the table?
I would say that it's, between all the stress and all the burden and decreased immune response and our adrenal response, our bodies are no longer able to, at some point, deal with simple allergens, and we start to get reactions. So it's a matter of strengthening the body, remove the allergens, and then also figure out how do we maintain and prevent that kind of healthy body system from there on.
Dr. Poe?
I would say that if you want to know that answer, I will tell you on Wednesday.
On Wednesday,
and
yes.
Because I have the answer, because I had a great education, because I had a wonderful mother, Leonard Poe. Happy Mother's Day. I love you. I'm going to railroad you. Happy Mother's Day, Mom.
Happy Mother's Day, Rainey. This Wednesday evening, Dr. Poe, Dr. Pina are going to give you the capacity, the ability to turn things around. And seriously, this is something that you can change. You don't have to suffer with it. There's exposures that you're getting into that you really don't have a clue that are actually happening. And the mitigation of those things are what's going to restore your health. When we see it from an acupuncture point of view, from a traditional Chinese medicine point of view, it's the aberration of energy pathways. And when energy is imbalanced in the body because of the structural, chemical, emotional stresses, if you will, then the body's going to break down. From a biochemical point of view, if you are looking at things that you're constantly exposed to, they have to change. But neurologically, your body has to work well. And that's the other piece that we haven't even touched upon today and that we will on Wednesday evening. Give us a call, 703.
Get the big picture.
That's right, 703-698-7117. Looking forward to seeing you next time and every Sunday at 12 noon. Next week, your host will be Dr. Leonard Poe and Sue Roselle, and they're going to talk about gluten sensitivities. See you soon. This is Dr. Roselle. Bye.